Howdy, everyone. Matt here. I got a question for you. What comes to your mind when someone says traditional physical therapy? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. But first off, thank you to everyone who has subscribed. If you hadn't, go ahead and hit that subscribe button. It doesn't cost you a copay, and it helps out the channel. But getting in on this, talking about traditional physical therapy. So when you hear those words, what do you picture in your mind? What do you think in your mind? And I was really thinking about this because I see these ads come up either from physical therapists or somebody outside physical therapy. So in physical therapy, it's somebody's marketing their clinic or their whatever, traditional physical therapy. You need dynamic, you need modern physical therapy, whatever that they're teaching, or people outside of it. So like chiropractors or a trainer, you're doing traditional physical therapy. You don't need to do that. But here's the thing. What is it? What is traditional physical therapy? And I get really that it's a very broad, general term. And what it does is it puts it back on you to fill in the blanks. So when someone says traditional physical therapy, you define it. And I can see if they say it in a negative way. Oh, you're just doing this traditional physical therapy, not getting results. So now you're going to start thinking of all those things that are negative about it. Oh, okay. What are they doing? They're doing those like ineffective things, and they're just laying on tables and they're just doing traction and ultrasound. They're just doing those. That's what traditional is. But is it really? Now I posed this question out, and I did ask people when that comes to mind. What do you think? And I got a few answers on it, and I want to kind of go through some of them, and then talk about a little bit else. Now I got about 12 answers. And the most common one was kind of like I said, it's somebody that, traditional physical therapy is like you come in, you lay on a table, you do some light weights, you may do modalities, heat, ice, e-stim, ultrasound. You do some of those. But interesting things, I did get some different things, different that I didn't think this was traditional physical therapy. So somebody said, taking evidence-based research and apply it to my practice. Make it meaningful, functional, and challenging. Okay. Is that traditional physical therapy? Is that not what we have traditionally done? Is to take evidence, to move and put forward and to help people to be functional, to do those things. Here's another one. Exercise-based interventions with the sprinkling of manual therapy paired with education in a safe space for patients to seek out knowledge. Again, traditionally with physical therapy, that's what we do. We're heavily based. A lot of us do a lot of exercise. There can be some manual therapy in there. And again, a safe space for people to ask questions that, hey, we're one-on-one. We're not going to ridicule you. We're going to make fun of you. We're going to answer those questions that you have that may be silly, that you may think are silly. I'm not saying they are silly. I'm just saying that you may believe are silly or I didn't know this. And here's another one. Traditional physical therapy is the practice of medicine that focus on improving quality of life and function of patients by using any combination of exercises, manual therapy, and other supportive treatment approaches. No matter what, treatment should be focused on education to give patients the tools to improve their health on their own once discharged. So again, traditionally, if we look back, okay, yeah, we're doing those things to help improve the quality of life with people. We're looking at doing that. And I also think it's interesting when we talk about this with traditional, at what point are we talking about? Where traditionally are we looking? Are we saying is the time frame to say is traditional in there? So where? Well, what time? Was it back in the 40s when we came about through World War II and polio? Is that traditional? Is that the thing? We were wrapping people in wool. I had a professor that was very, very, very veteran, as we will say, and actually remembered doing that, wrapping people with wool who had polio, because he said, we would heat it in these giant drums, and then you wrap them because they were just like an intense pain, and it would just help ease the pain that they were going through until we could figure out like where it had affected them. So is that it? Is it, in the 60s or 70s when things like, ultrasound and e-stim, when those things were coming? Is it in the 80s? Is it the 90s? Is it the 2000s? When is the traditional physical therapy? When is there? Now, that was just some of the comments, but I've seen some other things where people talk about it. And they said, sometimes, and again, the very most common things that people were saying for the vast majority of these questions, I believe it's like 6 or 7 of them, where ones that were just kind of pointing at that thing. Oh, you're doing some modalities, you're doing these lightweight exercises, and those things. But let me ask that: do you get patients that need that at times? Do you actually need it? And I'm not saying that you're just doing it willy nilly, but I'm saying they actually need it with modalities like a hot pack. Have you ever had someone come in and they're in a very emotional state, very heightened state? Maybe they had a stressful day at work. Maybe they're just in a lot of pain. Maybe they're just there. Maybe they just had a fight with their spouse or something, and they're just, it's like, hey, do you just want to take a few moments, go lay on a hot pack in a room, let everything calm down, just let everything decompress a little bit, and then you can come back out here and we can do stuff? Yeah, I've done that with a few patients. They come in just, is that, that's doing like, oh, you're just sticking somebody on a hot pack. Yeah, there is a reason to let them kind of come down so that we can be here in this moment, because we're going to go through something very active, but maybe they're in a very heightened state over there. Again, with education and stuff and exercise. Okay. Let's talk about exercise. They talk about, these light weights. How often do you actually have to use light weights? Okay. How often really? Light resistances and stuff like that. I see people you go to physical therapy, they pull on these light bands, which I find it's funny when people say that, and it's like, okay, then why are you having a hard time doing it? Okay. And I will tell you, a lot of patients are often surprised, like, oh my gosh, I didn't think this was going to be hard because it's these little light things. I'm like, yeah, it can be. After a surgery, are you going to be doing real heavy weights after a rotator cuff surgery or something like that? No, you got to stay within protocols. Sometimes we're just teaching a patient how to do a movement, so you have to use light resistance to get used to a movement. Maybe we're coming back into doing a movement after an injury. Somebody hurt their back. Okay, you're just going to be lifting 5 pounds. Well, 5 pounds is not nothing. We have just to get you used to doing that again and getting your confidence level up. Okay. Now, I will say, when you get into things like ultrasound, I am not a super big fan of ultrasound, but what is that a time that we can have an educational moment of talking about what this is, why we use it, why we don't. So I think we need to start really defining that. And also, I believe that we should not allow others to really define that for us or to use that negatively against us. So we've seen chiropractors or personal trainers out there talking about, you're going doing traditional physical therapy. I think the big point we need to make is to go define what traditional physical therapy is. Define it. If you're going to claim it, define it. Define exactly what you're talking about. And I may agree with you on it. If you say, well, it's super lightweight, okay, when would that not be appropriate? Okay, so let's get into this defining. Oh, okay, yeah. Shouldn't have people just laying on hot packs and doing lightweight if there are an athlete at a very high level. Which actually a very, very funny thing. I did see somebody talk about, with athletes that the PTs are not good with treating athletes. They said, like, yeah, a lot of times with athletes, it's getting them to stop. And I will tell you, some of the athletes I've seen, it's often telling them, hey, we got to pull back. You're working at such a high workload. That's why you're staying in a painful state or why you're having an injury. And again, this depends. It's going to vary with everybody. We have to pull you back. We have to slow down. We have to drop resistance to get you better. You're still wanting to work at this real high level. Sometimes we got to come back and let things, change up with the workload and stress levels and getting some of those things under control. But I think we need to start taking that back from allowing other people to really say, no, traditional physical therapy, and saying, define that. If you're going to make that claim, that you're better than this, What are you saying traditional physical therapy is? And once you define it, okay, in what instances is that not appropriate? Okay. Now, yes, I'm going to say there's going to be certain times when, again, you get certain people that you have to do certain things. But that's the thing with physical therapy. It varies so much, patient to patient. Everyone's going to need something different at different times, those things. Anyway, wanted to talk about that a little bit. Let me know, what is your definition of traditional physical therapy? When you say it, what do you picture in your head? Do you ever talk to other people about it to say, no, we need to get away from that. Let's quit calling that, quit saying that stuff, because we don't do that. Nobody does that stuff. Okay. You've just created a fan fiction of what traditional physical therapy. And it's like, yeah, maybe that was something from the 60s, but nobody does that stuff anymore. You created a story with something that is so outdated that nobody does it. And if they say, well, somebody does do it, name them. I've had, oh my gosh, there was a chiro on TikTok that does it. He talks about physical therapists keep using ultrasound. Who? Name them, please. Name them exactly. Name them. You shouldn't be doing that. Maybe there is an indication to do it, but name them. Never would. They never would. And then the funny thing is also you have chiropractors using those little nerve detecty weird devices. So it's like, interessante. But anyway, with that being said, let me know your comments, thoughts down in the comments below. If you like the video, hit the thumbs up button and subscribe to the channel. It doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.